Okay, so hopefully that recording is now on. Okay, so welcome everybody to this business webinar for Lancaster. We've over the pandemic, we have run a number of events similar to this, where we've done Teams briefings for businesses, which seem to have been reasonably successful, and I think have gone down quite well. So we thought this was a good time, as we're approaching the winter months, to bring in another webinar for businesses, so that we can give you a brief kind of update on what's happening, and also maybe hear back from yourselves as to what's good, or where you might be struggling or difficulties, and perhaps where we can help out a bit further. So to start with, just to remind people that using Teams, there is a chat function. If you see the little bubble that looks like speech bubble, if you click on that, then it opens the chat, so you can raise questions or put comments in the chat if you wish, as we go along. So hopefully that will be helpful for everybody. And just, the purpose of today is to provide an update, but also to provide some what we hope is practical guidance as we approach the winter months around ventilation, and how we can hopefully maintain safe environment inside businesses. And we're thinking particularly around hospitality, where we're getting people gathering. But it's not just hospitality, of course, applies to other businesses as well. So hopefully we'll give you some practical advice on how to do that. So we'll come on to that. So today from the council, we've got myself. I'm Steve Sylvester. I'm one of the environmental health managers in the public protection team. We've got Fiona Inston, who is the head of public protection here at Lancaster, and then we've got Lee, who's one of the senior environmental health officers, and Amanda and Nicola, who are business compliance officers, focused on providing advice around COVID. And then we've also got Rachel joining us today, and Rachel is the newest member of the team, and Rachel's been doing an awful lot of work around the comms, getting updating the messages, creating leaflets and advice posters particularly for events. So we've got a number of people as part of the team that are joining us today. I'll say a few words. I'll be kind of hosting and just making sure everything goes to plan. I'm going to ask Fiona, hand over in a little while to Fiona, who will give you a message from more of a general public health and what's happening at a higher level. And then I'll hand over to Lee, who will talk about the plan B and what that means, a little bit about COVID Pass, but probably what's more importantly around some practical advice on the managing ventilation within your businesses to hopefully minimise the risk to customers and to staff. Okay, so I'll move on to the first bit that I wanted to cover, which was really just a general overview of how the pandemic is at the present time, thinking locally and regionally and nationally. And I'm assuming many of you will have already been keeping an eye on what the news messages in the on the media around numbers. But just as a quick kind of reminder, the most recent number of cases was around about 34,000 new cases that were recorded yesterday. So that figure is still high, and I think there is some concerns at this time of the winter, at the beginning of the winter. That's still a very high number to have reported. They talk about the rate of infection and cases, and at the moment nationally that's around about 416 cases per 100,000, and I'll come on later to talk about how that compares locally. Death rate is still, unfortunately, still quite high, around about 300 deaths per day at the moment, and there are still demands on hospital beds, which I don't think are at a critical stage, but there is certainly some concern about the number of cases in hospital. So there is a bit of a worry at the moment that that number is still too high for this time of the year. So the figures for our area, talking about new cases per 100,000, around about 327. So we're below the average, but that's about 480 cases in the last 7 days. And we've got quite high levels still within the 11 to 16-year-old age group. But that, looking at the figures, looks to be coming down slightly, which is good news. But when you compare that to regionally, what's happening across Lancashire, Lancaster is round about the 4th from the bottom in that league table of cases. So that's good news for Lancaster. So we are keeping those numbers down. So that is good news. That does vary from week to week, but that's good news for the moment. Some changes that are taking place coming up in the next week. You may have heard about this introduction of compulsory mandatory vaccination for care staff, and it's not just people working in the care sector, but it's also people that are visiting, going in, including our own staff if we have to go in for inspections. The requirement that there will be fully vaccinated. I think that comes in next week. I think it's probably the 11th of November that will be coming in, and we have done quite a bit of work trying to remind care staff, care providers about that change that's coming in. And we're still operating or offering a testing service. We've recently closed the testing facility that we were operating here at Morecambe Town Hall, but we are operating that now at a community level where we're providing lateral flow test kits free of charge to people if they want to collect them. Currently around about 500 business premises with home test kits that we're providing, and we're also at providing a testing service at different points within the community. But the best way to find out where that's going to be is to have a look on our website, and we've got the details there about where the testing service will be on what days. So we're quite happy to help out where we can with testing, because testing is still a very important critical part of controlling the pandemic. So we certainly encourage everybody to continue to do lateral flow tests and keep a very close eye on your staff as well to make sure that they are doing the same. So we'd certainly want to see you encouraging that. Okay, so that's what I wanted to introduce as the kind of basic what's happening locally, regionally, and nationally. I'm going to hand over now to Fiona. Hopefully, Fiona, you're ready, just to talk about what's happening higher up, county council, government, more of the general message from the top around public health. So thank you, Fiona. I'll just hand over to you. Thank you.
Cheers, thank you, Steve, for the introduction. So as Steve said, I'm head of public protection at the City Council, and I've been working closely with the County Council. And I suppose when we reflect on our journey, one of the concerns that we always have with any virus, and when people will be familiar with this with the flu, and that's why we have annual flu jabs that have different strains, that viruses mutate. So the concern that we have at the moment is that what we call is the prevalence, so the general number of infections in the community. The more prevalence you have of a disease, the more a virus, the more likely it's likely to mutate. So that's a big risk. And at the same time, we're coming into winter, and Liaison will talk about ventilation, etc. later, and the importance of that. But what we normally do is we shut windows, shut doors, and we're more likely to be gathering closely indoors and not the outdoor gathering. So there's some real pressures on the winter, and what does that look like? In terms of the predictions, I mean, it's really hard. There's been lots of modelling. The most I hear is it's going to be a hard winter. What that actually means in terms of case numbers and hospital admissions, and then sadly deaths, that's still really to be unknown. And as with all viruses that are really new, we learn more about them. Obviously, initially, if we think about COVID, we initially was really concerned about the person-to-person transmission around hand hygiene, and now obviously we know the importance more around the ventilation and how it's spread. So I suppose from what we have now is this transition of being in the pandemic and living with COVID and stopping to revert back to what we were doing. We're going down to snap lockdowns, business restrictions, and how do we work and support businesses and support each other to be living with COVID? And I think that's kind of the key, and hopefully that today's messages will be really helpful in terms of how we do that. In terms of what we do know, though, is we've had a slight drop in cases, which is great. We've also got things like the half term that's just happened, and what we do know is normally with cases, when there's an increase, the hospital transmission lags are normally about 2 to 3 weeks behind. So we closely monitor the stats and hospital admissions, because I think that would give an indication if we were ever to kick in Plan B. But also the key for me, I suppose, is we started off long before COVID talking about infection control. A lot of if you come from a food business, be aware of the importance around things like cross contamination. The messages are still really key messages. They reduce transmission of any infection in your workplace, which will keep your staff back in work from a business continuity point of view. So it makes real business sense in terms of the infection control. And I think what we really like to talk about is that transition of some of the principles that we're going to talk about will save other kind of norovirus, if you ever heard the DMV type, diarrhea and vomiting type bugs. So the really key important infection control messages. I'm trying to, so that kind of my headline. So I think it's wait and see what the winter brings, but it could be a really challenging winter. And I know a lot of businesses have faced a lot of significant challenges already over the last 18 months. And I suppose things like supporting the vaccination, the boosters, etc., they'll all put us in a good place for the winter going forward. So, Steve, I'll pass back over to you.
Thank you, Fiona, for that. Thank you. Yeah, it's very much kind of watch this space, isn't it? That we can't assume anything at the moment, so we just have to be very remain cautious. And I think that's why Rachel has spent a lot of time trying to refresh the message that we're sending out, because we know that everybody kind of wants to return back to normal and to try and forget about COVID, but we can't do that for the moment. But it's also flagged up, as I think recently flagged up, that there are other concerns, that it's not just COVID now as we approach the winter months, that the seasonal flu may be of concern as well. That's why the government is encouraging everybody who's eligible to have the seasonal flu booster jab. So it is a general public health message that we're trying to get across, is this is good practice. The stuff that we've learned through COVID is just generally good practice anyhow for any kind of infection control. Being sensible, taking sensible precautions. So the messages that the new message that we're sending out is hopefully just trying to get that across, that look, it isn't over. Let's just carry on being a little bit cautious, and then hopefully come into the spring, and that's what everybody's anticipating. Providing everything goes well, get into spring, and that's when we can hopefully really look back on COVID and think that was something that's in the past now, and look back on it rather than looking forward. So for businesses, we would like you to spread that message to your customers, and we will share this when we send out another email. We will put a link to all the artwork for the posters. All of that will be available to download from our website, and we'll also get packs of the posters and leaflets out to the bid offices, if anybody would like to collect them, and if anybody wants for us to deliver them direct to you, we can arrange that as well. So that's just trying to press on with that message that yes, I know everybody's bored and fed up with talking about COVID, but let's just keep trying. And trying to switch that message a little bit away from just COVID and thinking, well, this is actually good, kind of common sense. Okay, so that's enough from me for the moment. So I will going to hand you over to Lee, who's going to talk about some kind of practical guidance and what you need to be thinking about with your risk assessments, and hopefully some good news about some carbon dioxide monitors that we'll be able to make available. Okay, thank you, Lee. Over to you.
Thank you, Steve. So Steve's asked me to come on today just to have a chat with you from the environmental health team. So we're the ones that probably come out and seen you, and we've probably dealt with a number of us before previously. So some of the things that we're sort of getting asked at the moment when we're going out and doing visits is, well, COVID's finished. What do we need to do? COVID's gone. You know, what measures can we put in place? There's no legal requirements. And so some of the things that we've been talking to business about, there's still a legal requirement to put in place a risk assessment. One of the things we're finding is that a few businesses are struggling to sort of get their head around what a risk assessment is and what they need to put in place for it, especially in relation to COVID. So we're just going to come in and have a discussion about that and discuss what we should be, or we'd be expecting to see when we come out and do some visits. So with regards to your risk assessments, this is something that any business with 5 or more employees needs to have in place in writing. I mean, if you have less than 5 employees, then you can need to have a risk assessment in place, but it doesn't have to be written down. We'd always recommend that you do write it down, though, because it's an easy way to just prove to you and to us and to your staff, you know, and highlight the measures that you've taken and discussed. So some of the things we've been sort of working with businesses about and looking at sort of the hazards and the risks and risk management. So a lot of places have already kept measures in place from, you know, that were already there. And one of the main ones being adequate hand washing and discussion, and promoting hand washing, having good hand sanitizers at the entrance. And we've done some work with members of the public and did a survey, and a lot of members of the public still wanted to see hand sanitizer at the entrance to businesses. And it's great that most businesses, pretty much, you know, 99% of businesses still have hand sanitizer available at the entrance and within the business. And that's one step, you know, that businesses should be taking. The other one, just promoting good hand washing. So that's something we're doing a lot of work on, going and checking toilets, customer toilets, staff toilets, making sure that if you are saying to customers and to staff, you know, maintain good hand washing, that you've got the facilities there to do it. So making sure you've got hot water, making sure you've got soap and drying facilities and things like that. Because time and time again, and you'll probably know from yourselves, you go out and about, you go into the toilets and there's no soap, you know, which is a poor start from any infection control point of view. So we're asking people to look at things like that, look at things like cleaning, so putting in place cleaning schedules in toilets. These are nothing new, but these are things that some people haven't been doing, and we'd ask that people continue to do those. One of the main things, and Steve alluded to it then, is communication. So, you know, the communication with your staff and with the customers about, you know, don't attend this venue, don't attend work if you're ill, if you feel unwell, stay at home, get a test. And that's one of the main messages that central government still need and want to get out there, that if you don't feel well, you don't come to work and you do a test, because time and time again, that's one of the common elements we see, that, you know, there's outbreaks in businesses, and it's usually started by somebody who's turned up to work who didn't feel quite right, transpires that they had COVID when they went and got a test. So for a business sort of continuity perspective, that's something that can't stress strongly enough, that you highlight that message to your staff and you ask them to not come in. We also recommend, and we can help provide these test kits for lateral flow tests. And I guess a lot of you are already doing that. But again, lateral flow tests, very easy to do. Recommending you do it twice a week, because most people, about a third of people, can transmit the virus without having any symptoms at all. So it's a real early indicator for you that if you're turning up to work, you do your lateral flow test before you get there. If you do it at home or when you arrive at work a couple of times a week, then you're less likely to start spreading that around the business. Again, with Vaccinations is something we've raised with businesses. We're asking businesses to sort of have that discussion with the staff, ask if they're vaccinated. Again, from a continuity point of view, still very important around isolation. So this is something that's often forgotten, that if you actually are ill or you've been told to self-isolate because you have COVID, then that's regardless of whether you've been vaccinated or not. So you need to make sure that people are still very aware of that and inform you before they come to work that they shouldn't be turning up if they have COVID. And that will go to people as well, still people to require them to self-isolate if you haven't been fully vaccinated. So if you haven't been fully vaccinated and you've come into close contact with people, i.e. either at work or at home, they still need to self-isolate, and that's still a requirement that's going to help reduce the spread within your business. Some of the other things, just cleaning, and again, no reduction to cleaning, so making sure that the whole touch points, people that enhance your cleaning, that trying to minimise the hand contact points, leaving doors open where you can do, reducing any hand contact points of menus or anything like that. So still recommend that you be putting points in relation to that. Again, we'd still talk about face coverings. That's sort of something that has disappeared in a lot of places. There are still some workplaces that have mandated that in their business. Lancaster Council on their work premises, they still say if you're away from your desk within the building, you should be wearing a face covering. And we do hear time and time again saying, well, we can't force people to do it. But if at the end of the day, it's your business, if you decide that's a requirement for your staff, then that's something that you can put in place and enforce. I mean, there's large multinational chains that have done this. You're probably seeing takeaways that you'll go to these businesses, all the staff are still wearing face coverings. So at the end of the day, if you feel that the risk is high or high to your staff, then it's still something you can mandate. I mean, we might be getting as well, one of the things to be thinking about since we've gone into step 4 is more and more people coming back into the workplace. So having a look at recognising those vulnerable people that are coming back into the workplace, having that discussion with them, making sure that any sort of the risk to those is reduced, maybe move them away from public facing jobs or tasks. Maybe those are the people that require face coverings. I know there was discussions about whether the face covering actually protects you or protects others, but there's been further research done on that, and there's certain face coverings, FPP2 face coverings, that they've done research on, found it'll protect from about 94% of viral sort of inhalation. So there are measures and different means out there to sort of prevent and reduce the risk to those more vulnerable people. But more than anything else, one of the main things the government have been talking about is ventilation and increasing the need for adequate ventilation and good airflow into your business. And this is something that the HSE will tell you is nothing new. It's been a requirement for a long time, but it's really been brought to the forefront now. And it's certainly becoming more important as people move indoors, as the weather changes, as it gets colder. We're going out and doing inspections. We're finding more and more people saying, well, it's getting cold and we get complaints about drafts. What can we do? So we've been going out having these discussions with businesses, and one of the things we've done recently, as Steve started mentioning then, is we've purchased some CO2 monitors, and we've been taking these out to businesses to find a bit of a baseline level as to determine the level of ventilation in businesses, because we've been going out saying, well, government saying increase ventilation, but in many cases there might not be an issue. So you need to have that baseline idea. And we purchased a load recently. We've been trialling them in some businesses. And if you are interested, then let us know, and we can come out and we can trial them in your business, and we can show you how to use them, show you the readings that you will be looking for. And we can also offer to sell them as well for a reduced rate of £20 if you're interested or want to keep it on after a trial. So the thing about ventilation, it's not just about opening all your windows and doors. One of the things we've been finding is when we go out and do these inspections that there has been in the past adequate ventilation through fans and wall fans and vents and window fans and trickle vents and all these things over the years have either stopped working or become blocked up or things like that. So one of the things we're saying to businesses, it's not just a case of fully flying over, fully opening all the windows and doors, especially as it gets cold. We're looking at just trying to subtle ways to improve ventilation. And by having these monitors, it's a way of being able to help determine, what measures work best for you. There's all sorts of different measures as well. There's a recommendation from government that you open all the doors and windows before people come in as part of an opening procedure, and close them as people come in, or even if you don't leave them open all the time, if you open them for 10 minutes every hour at busy times, that can significantly reduce the levels of CO2 and potentially COVID. The link there is that CO2 acts as a proxy for detecting COVID potentially in the air and atmosphere, because it's transmitted through aerosols as you speak. So the same as CO2. So when you're talking, you expel CO2. So the theory is the more CO2 in the atmosphere of the building, the more potentially COVID if you've got people stood in there talking whilst they've got COVID. So again, all this information is available on the HSE website. There's a full page dedicated to ventilation on there that you can go have a look at these levels, have a look at the monitors, and say, come to us with regards to the monitors, because you won't find them any cheaper. And they're a great way of just determining if and what measures you need to be putting in place and taking. If, for instance, you can't improve your ventilation, again, it states in there about what measures you can take, and there's measures such as air filters and things like that. So these are other measures that if you're really concerned that, you look at your building, you think, well, I can't open the doors. We find that a lot. We can't open the windows because they're sealed shut. Then there's other measures available out there. So again, if you ever look on the HSE website, you can have a look at filtering machines and things like that. So that's really where we've been out and going out and talking to businesses, talking at risk assessments, what should be put in place. And then Steve's asked me to go on to talk about sort of plan B and what might come in the future. So just thought I'd talk about plan A there, which is where we're currently at, and what that means for businesses. So having looked at plan A, the current requirements of plan A for businesses, to ask everything that we've just pretty much discussed, to ask employees that they stay at home if they're feeling unwell. That's point one for businesses. Ensuring that there's an adequate supply of fresh air, so ventilation, again, important. Providing hand sanitizer and promoting hand washing, again, as we've discussed. Continuing to display a QR poster so people can check in and still be notified by track and trace if there was to be an outbreak. And to consider using the COVID pass. So the COVID pass, the possibly heard, it's mostly being used in relation to events and in relation to large scale events. And it's basically a way of proving that you've had been double jabbed, or if you've had natural immunity or a lateral flow test negative result. So under plan B, if that was to come in, and the only requirement to introduce plan B that we're aware of and as stated in the plan B document is if the NHS is to come under unsustainable pressure, and that's the requirement at which they'll introduce plan B. So 3 points detailed in plan B, if this was to be introduced, would be to communicate to the public that the level of risk has increased and that they should be taking a more cautious approach. Point B is COVID certification, and this would come in and would change from its current format to only include, at present, the government stated it will only be available for people who have received full vaccination. So it will be down to businesses in certain criteria, and those are all nightclubs, and that includes at present, as far as we're aware, bars that open past 1 o'clock, provide music and dancing and alcohol. So they'll be required to do this. It'll include events of over 500 indoors, events of 4,000 outdoors, or 10,000 seater arenas, things like that. So that could be a requirement that comes in for possibly some of you. And as Steve said, it's something that's coming in for those who are going to be doing work in care homes from next Thursday. So the COVID pass has been proposed as the solution to that, to be able to provide your vaccination status to enter and work in a care home. So you don't have to provide this if you're going to visit a relative, friends and family, they're exempt from this. But if you were a hairdresser or you were going in to do any maintenance work or anything like that, as soon as you cross that threshold, that care home has a requirement to make sure that those entering the building can prove the certification status. And then the other part for that, the only other part of plan B would be the mandating of face coverings, and there's very little information out there as to who would be included in that. It simply says in that it'd be decided at the time So we can't sort of say who that will include or what businesses that will include, but obviously we'll find out closer to the time. And obviously that's just be going back to where we were previously, asking customers to wear face covering. And, you know, potentially I suspect if it's businesses, restaurants, pubs, if it's whilst you move around, then it's going to be, you know, some level of management in relation to that. And fourthly, the government has just mentioned about working from home. So again, that's still very much the message. If you can work from home, you know, that's been, I think we found that's one of the greatest achievements, reducing the risk of spread of coronavirus is by, again, just limiting people's contacts. And that's it for me, Steve.
Thank you, Lee. That was very helpful, and hope everybody got something out of that that advice. And I know Lee and Nicola and Amanda have been doing a lot of work with businesses, going around providing advice and support where we can. Particularly around events, we've had a number of events recently, such as the Lancaster Music Festival, as an example, going around and giving advice to those venues that were hosting part of the festival. And a few of us were out actually over that weekend just to observe, just to see how things were going. And I suppose, to be fair, it was kind of mixed. There was a lot of the venues were managing it really well, I think, and security staff were on doors of pubs and reducing the number of people that were coming in, so keeping the numbers down to help allow for a bit more social distancing within the premises, and keeping windows and doors open where they could. But we know there is a dilemma. We know that there is a problem, that if you've got, particularly where you've got a music festival, if you've got all the doors and windows open, then there's a potential there for people complaining about noise. So we recognise that's a challenge, and there's a conflict there. We say open the windows for ventilation, but then there's a potential that it may cause a problem for neighbours. So we recognise that that's not easy, and I think that's where having some, you know, science behind that general message of open doors and windows, getting some actual readings using carbon dioxide monitors will really help to know whether do I need to have all of these windows open or not, and that would be hopefully be very, very useful and practical assistance to businesses. But I think the one thing I took away from that, the visits that we did over that weekend at the music festival, was the difference that having security staff on doors can really make. If you're concentrating on operating the business indoors, inside, serving people, keeping customers happy, having somebody on the door to keep those numbers down, to say that it's full, to manage that for you, certainly seemed to make a big difference. So that was definitely something positive that I took away from that. Okay, so what I said I would do next was really just to kind of put that question out there to businesses, to anybody really, as to what else we could do as a local authority to support businesses. And we do mean that genuinely. How can we help businesses? We know it's been difficult times, and we have run some food safety refresher training courses. Obviously, we run webinars like this, but what else is there that we can do that might help businesses? We can provide more training. One of the topics that's in everybody's mind at the moment, if you're in the catering business, is allergens, and the new law on labelling that's come in. So maybe there's something there that we can provide around allergens. We do have an allergens training course that we've operated before. Food safety refresher training, health and safety refresher training. So all sorts of things that we could offer, and we'll be happy to consider requests from businesses as well. So please let us know. We've had the COVID Safe award scheme, which is still current. We know that, as Leah said, that the mandatory requirements have gone now, that we have stepped outside of those COVID control measures. But we know that the public a lot of the public are still very aware and are choosing to go into businesses where they feel safer. So the COVID Safe Award scheme, whilst it's been adjusted because it's no longer mandatory to have face coverings, etc., is still valid and is still sending out that message to the customers that it is safe to come in here. So if there are other businesses that want to come on board with that, then we're still quite happy to do that. We're also about to launch a pilot, which is a new customer safe scheme, which will be eat safe, drink safe, etc., etc. There are different varieties of that theme around customer safe accreditation schemes or assurance schemes, which is encouraging feedback from customers. But unlike some of the like TripAdvisor as an example, it's not in the public domain, it would be managed by us. So all that feedback would be managed by us. So we think that's another way of trying to encourage more customers to come back into businesses. And I'm thinking perhaps more of the retail rather than hospitality now when I'm talking about encouraging people back. I think there are some in the hospitality sector, you may not be up to full capacity, but there does seem to be quite a strong customer base at the moment. But certainly with the retail, maybe the customer safe scheme might be something that you as a business might want to get involved in. So we're at that stage where we are launching a pilot within the next few weeks. We've got 50 businesses focused on the hospitality sector that are already signed up to that. So watch out for that. And if anybody wants to come on board with that, after we've piloted it, hopefully you'll all want to come on board with it. But if you really want to be part of it, then do let us know, and we'll do our best to get you involved. So that is an open kind of invitation to all businesses. If there's anything else we can do to provide support around training, anything like that, then we're happy to entertain that. And I'm hoping Fiona will support me on this, that I think that we should be able to offer that at a much reduced rate to what we've been offering before. And we have offered free training in the past. So something, Fiona, that we in the team were talking about this morning, about whether we should provide it free of charge or at a discounted rate. But certainly that is something that we will be happy to provide for people. So at this stage, I suppose if I can open that up, if anybody wants to suggest now whether there's any support that you want us to provide now, you can either put that in the chat, or you can put your cameras on and microphones on and ask now, or for anybody who'd like to think about it and come back to me, I've dropped the general email address into the chat there, so do send us an email with your thoughts on where we can perhaps provide a little bit more support for you. Okay. So I haven't seen anybody put their hands up there, so I'll move on to the to the next bit, which is just something new that I wanted to kind of launch at this webinar, on the back of what I think is an improved kind of relationship that we've worked on with businesses over the pandemic. Really want to keep that momentum going, and that we keep those channels of communication open with business, because it really is important to hear what you've got to say. So what I want to try to launch in the next month or two is a new concept of having a food business liaison group for Lancaster, and that will be made up of businesses across all ranges of businesses, from retail, hospitality, catering, takeaways, all of the types of businesses that we've got out there, where we have an interaction with you as a regulator, and we would have that group set up where we can talk to you about maybe regulations that are changing, like the allergens, for instance, how that actually impacts on you, but also explore some of the barriers that you find that if you're a food business and you want to strive to be a 5 rated food business but can't quite get there, what is it that's holding you back as a business? Is it training? Is it a language barrier? What are the issues there? So that would give us that opportunity to open that conversation and explore different ways. So again, I'm opening that invitation out to businesses. Anybody who wishes to join that group, please let us know. And that's really good. Thank you, Lucy, for that message there. So that's really good to hear that. So thank you for that. Thank you. So we'll open that invitation to anybody who wishes to join us. So drop me an email, either using that general email or my work email, which I think you may have on the messages that have been sent out, and then we will set something up in the next couple of months. Okay, so I'm kind of getting close to the end, really. We were thinking about an hour, and it's roughly coming up to that now. So we did ask if anybody had any questions. I will open this up now for anybody who wants to raise any questions. But whilst you're thinking about that, there are a few questions that came in, which hopefully Lee, Amanda, and Nicola, you can help me out when comes to answering these questions. So I'll just run through the questions that we've had that have come in. There is a question about the fact that the regulations are no longer mandatory, so there isn't any obligation to conform to what we've been talking about. So why we're still talking about that? I think Lee's probably covered that quite well. That this is certainly under the Health and Safety at Work Act. There is still a risk assessment that you have to do, and you still need to think about looking after your staff, looking after customers. But that general message is we just need to keep going a little bit longer until we're absolutely comfortable that we are coming out of the pandemic. And as Fiona has said, we're not there yet, and it can change as we're going along. So let's just see. Mention the carbon dioxide monitors and what happens if the carbon dioxide levels are too high. And what to do there? Well, again, that's hopefully fairly practical now. Look at opening windows if you have them. I know that might be a struggle for some of those businesses where your windows are few and far between or stuck. And I will perhaps ask Lee to come back on this one, or even Fiona. The question is, are lateral flow tests really effective? We would prefer to do a PCR test if staff present symptoms and skip the LFT. We have heard in the media that they are not effective. I think we've all kind of had those anecdotal examples where my friend has had COVID and then had 2 negative tests before a positive PCR test. A lot of the stuff that we do here in the media. So Fiona, do you want to say a few words about that one?
Yeah, I'll pick that up. So I think reflecting back on Lee's comment is a third of people haven't got symptoms. So the danger is with the PCR test that it would miss out quite a lot of people that are asymptomatic. So regular lateral flow testing twice a week, I would definitely encourage just to pick up them asymptomatic. And what we found in the research is actually they're much more effective than we thought. Sometimes what you have with the PCR test as well, if you've had COVID in the 90 days previous, it will also show as a positive. So there's some, and also with a PCR test, if you have symptoms, definitely go and have a PCR test. But the routine screening, the lateral flow is a good routine twice a week to be getting your staff into. One we definitely advocate, one we do with our own teams, and we found it in starts of, it has prevented outbreaks into workplaces. Also, the other thing is if you're relying on a PCR test as your screening routine, obviously it takes 24 hours normally for a test result to come back. So, regular lateral flow, definitely the way forward. If anyone's got symptoms, then go for PCR, but I wouldn't just rely on waiting for symptoms and then a PCR test. So hopefully that helps, Steve.
Yes, thank you. Thank you, Fiona. That's really good. Thank you. And we've got one last question that's been raised, and I'll Lee, I'll just give you a warning. I'll turn to you to answer this one. Why is the council carrying out spot checks when the HSE are as part of their spot check programme? You may have seen messages I've been sending out about the HSE, the Health and Safety Executive, doing spot checks because there were some questions about whether they were bogus or not, and they are legitimate. We've ironed that one out. I think it was an officer that wasn't perhaps following protocol as they should have been. So there is a possibility that you may get a visit from the HSE. But Lee, do you want to answer that?
Yeah, just so people are aware, the health and safety legislation is enforced by two bodies, the local authority and the HSE. So HSE traditionally, traditionally deal with higher risk premises, factories. They'll deal with theme parks or anything that requires more specialist knowledge, and it's the local authority who'll enforce in most businesses, local businesses, cafes, restaurants, offices, things like that. But to help out with the pandemic, the HSE did offered to do some screening calls. So throughout the pandemic, they've been doing calls to businesses to check their level of compliance, and they've run through a standard questionnaire. So to continue that up now, they've gone back to businesses that they couldn't get hold of, and in Lancaster's area, there's a list of about 400 businesses that they're coming back to, and they're actually doing on-site visits, and those are in local authority enforced premises. So they're just doing it really to help us. And if there's any issues, then it gets flagged back up to ourselves for action. But to be fair, most of the comments that have come back out from the HSE have been very positive, and we've not actually had to step in or take any further action against any businesses following the HSE inspection.
Thank you, Lee, for a comprehensive answer there. Thank you very much. That's very helpful. Okay, that's all of the questions that we've had raised. Before I wind it up, it's just whether there's any other questions that anybody has that they would like to ask, or whether they've got any comments about this kind of format. We wish to continue to do these as and when we feel it's appropriate, just to do an update. And it does seem to work now that we are used to using the Teams approach. And now that we record them and put them on the website, then they're available for anybody else who wants to look at them. But if there are any other questions, please ask now, or failing that, if you want to, and if there's anything that comes to mind, drop us an email and we'll do our best to answer. Okay. Fiona, is there any last words you want to say just before we wind up?
Yeah, so I suppose this is, as Steve said, really, it's a genuine offer for us to work closely with businesses and offer support. We're also encouraging other districts to do the same. So there's a programme called Better Business for All, how regulators, so environmental health, fire, trading standards and others work closely with businesses, with people like Boost and the Growth Hub and other agencies. So we've got a real commitment to be working closely with businesses. So yeah, get in touch if you've got any ideas, give us feedback. We're really open to it. I think that the long time ago, people used to have a fear of the regulator. Businesses want to do the best, but we also want the best from businesses. So we've got the same goals. We want to be here to support business growth. So yeah, let's start the conversations.
Thank you, Fiona. Thank you very much. That's very helpful. Thank you for those closing remarks. Okay, everybody. Thank you for attending, and I hope you found that useful and got something out of it to take away. Take care, everybody. Thank you, and we'll speak to you and hopefully see you soon. Take care. Thank you. Bye.